Today we're going to learn how to change a dressing on a central line. The central line is here in the internal jugular. The supplies you will need is a pair of regular gloves, a dressing change kit for central lines, and if this does not have the chlorhexidine in it, which this package does not, then you can get it individually. So that's what you need. You're going to explain to the patient that all you're going to be doing today is changing this dressing, and that while they're changing it, the patient will need to turn their head in the opposite direction of the dressing. The patient will have on a mask, and the nurse will have on a mask. So when you're ready to take the old dressing off, you can use just plain ordinary gloves. You would wash your hands, put your gloves on. These dressings are sticky. Sometimes they're kind of hard to get off. You need to be as gentle as you can so that you don't irritate the skin. And you also need to anchor this little part right here. Normally this is sutured in with a couple of sutures. Sometimes it is not. Regardless, you need to always keep your finger on it so that it doesn't come loose. So you get a hold of this. And just take that off. When you take that off, you also want to note the port of entry. The tubing will have little increments marked on it, and you want to see what increment it is marked at, because if it comes out further than it was, you will need to notify the physician. Now I'm going to open this sterile packaging. And you will see that the masks are right on top. So I would place one mask on the patient. And I will put my mask on. I'm going to go ahead and open this since it's not in my package. But I'm leaving it in the package until I'm ready to use it. Can I take this off? These are my sterile gloves. We'll take that out for right now. And there are my sterile supplies. I'm going to put my gloves on. Just a minute. Since you know you're going to have to wear sterile gloves and maybe the size that's in the package doesn't fit you, you can bring in your own package. Now, as you can see, I got 2 fingers in one hole. But since I have on my other sterile glove, I can adjust that now. All right, so the first thing you're going to do then is this is the chlorhexidine. These got these 2 little arrows here. You squeeze in, shake it down. So now this is going to be coming out. So again, you're going to be careful not to pull this out. You're going to clean with friction. Up and down. Get underneath it. Then you're going to go back and forth on it. And then in the end, you'll be going in a circular motion, and you go in a wide circle. You need to let that dry by air. You don't want to blow on it or anything like that. You don't want to put the dressing on while it's still wet. The dressing that we use, we call it a biocclusive. If you'll see right here, there's a place that you could put the date on it and a place where you could put your initials. So I'm going to peel this off. You want to make sure that you cover this site, but you don't want to occlude these tubes going in. So I'm going to turn it sideways like this. Put that on. And then this peels off. Then just try to kind of smooth it down as you go. In a real world, on a real person, this probably would not have as many wrinkles in it. It would probably be more secure. Then you would take a pen and put on your initials and the date and time. And this should peel off. And then you would put this where it could be seen. Then you take the mask off the patient, take off your mask, you can take off your sterile gloves, and then you would document the date and the time, and that you used aseptic technique, changing the dressing, and that the client tolerated it well.